So this is our first low back pain and neck pain webinar. A little bit about me. Oh, I'm glad that everything's working. A little bit about me. I have been a physical therapist for 13 years, and I'm a doctorate of physical therapy, from USC in California. I've also had several brushes with back pain in my life. I had, first of all, a bad snow tubing accident, which I'm actually pretty sure I herniated a lumbar disc with. But thankfully, knock on wood, with my own PT and my own strengthening, I'm asymptomatic. Number two, childbirth and early parenthood. If you guys are parents, you guys probably know childbirth does a number to your body, and what's even worse is the 2 years of diaper changing and bending over and picking them up. So that might be something you guys can relate with. Third of all, I've also had bouts of neck pain throughout my life. I've been, I'm guilty as charged. I have had poor studying posture, and I was a recreational boxer for 7 years of my life. So I've been kind of bashed in the head a number of times. Trust me, it's really fun, but you kind of have to know what you're getting yourself into. And lately, because I've been working from home a lot on the laptop of my daughter, I've been experiencing neck pain myself. So I know a thing or two, I felt a thing or two, and trust me, I have great sympathy for anyone suffering through these things. So it's not like as though I come in completely, unknowing. All right, so with this back and neck pain webinar, I'm going to go through some main things. First of all, I'm going to go through some common causes of low back and neck pain. I'm also going to go through how a problem in your back can cause pain, numbness, tingling, or weakness in your extremities. So some of you might experience this more than just pain. You also might have those symptoms like numbness and tingling. And why does that occur? And what can you do about it? And then last but not least, I'm going to go over the single biggest mistake back pain and sciatica sufferers make, which actually stops them from healing. Wonder what that big mistake is? I will get to it soon. So first of all, common causes of low back pain and neck pain. Now, guys, this is a herniated disc. That red thing in the middle is a herniated disc, okay? What it is, it's basically a disc that's kind of bulging out from where it should be. So if you look at that light blue disc on top and on bottom, that's what healthy discs should look like. Now, if you've experienced trauma or bad posture, that disc could protrude out and then actually could knock into a nerve or structure that it shouldn't be pressing on. So characteristics of the herniated disc for the back, it's increased pain with bending forward, twisting, coughing, or sneezing. Sciatica pain is usually sharp and it runs down the back of the leg. By the way, sciatica pain is an umbrella term for any nerve pain running down the leg, whatever the cause. So be it from arthritis, stenosis, ankylosing spondylitis, anything at all, if you have symptoms down the leg, it's deemed sciatica. So guys, you'll hear, oh, this is the best cure for sciatica, or X is the best cure. Well, it's kind of like saying, well, this bottle is the best cure for colds. We already know that there's multiple things that could cause upper respiratory issues. Same thing here, sciatica is just an umbrella term, okay? So you shouldn't be looking for like one-off miracle cures for sciatica. Nerve pain from herniated and bulging discs can occur in the shoulder, arms, or hands. So if you're experiencing numbness in the upper arm, for instance, or in the wrist or in the hands, a lot of people turn immediately to, oh, carpal tunnel syndrome. However, a good physical therapist would check everything upstream to that nerve. Okay, so don't trust everything that you see on the internet. And this is happening on the internet, ironically. Okay, so herniated disc sufferers are usually 40 years of age or younger. The reason why is because these discs in younger folks are more squishy and they are much bigger and thicker and full of gelatinous liquid. So when you're younger, you're more prone to bursting a disc or herniating a disc than you are when you're older. After 40 years old, those discs desiccate, they dry up, and they become firmer, which is kind of a good thing, but a bad thing because of something else called arthritis and stenosis. Okay, so with arthritis and stenosis, when you look at the pieces of bone there, vertebra, where it points to there, and those discs in blue, the discs become desiccated. Like I said, after 40 years old, they dry up, right? So what happens when they dry up? They get shorter. And as they get shorter, those spaces that the disc elevates out and pushes out, those spaces is where the nerve travels through. And so when those spaces are squished, the area in which your nerve can travel through is now reduced. It actually closes down a foramen meaning a hole. So if there's a disc right here and it gets squished, now the hole's getting small. Guess what? The space where the nerve can go through is now reduced. And that's what causes your numbness, tingling, and sometimes pain shooting down the leg. So common symptoms of arthritis and stenosis: pain with standing and walking, right? Because when you're standing and when you're walking, that disc gets squished even more as you put body weight into it. And when the disc gets squished even more, you'll get that numbness, tingling sensation. Relief with sitting. It's relieved with sitting because you're no longer putting as much body weight onto your discs as with standing and walking. Stenosis, for you guys who are 50 years and older, if you have back pain that has been chronic and doesn't seem to go away, most likely what you have is stenosis and arthritis. So, and that is very, very prevalent, by the way, for folks who are above 50. Very prevalent. Now let's talk about arthritis or stenosis in the neck. Okay, happens very similarly. Those discs over there gets narrowed up on the right side there. You'll see an osteoarthritic spine. And what happens with repetitive wear and tear in the neck, because we have to look around, look at your blind spot when you're driving, etc., you end up creating bone spurs. And bone spurs is your body's natural way of protecting itself with extra bone and extra structure to stabilize it. However, the caveat with a bone spur is that it reduces movement. So it actually makes your neck really, really stiff with arthritis. Common symptoms: popping or grinding sounds in the neck, headaches, muscle spasms, numbness and tingling in the arms and hands. Oh gosh, I'm not sure whether I'm muting everyone, but if everyone can mute themselves, that'd be great. Great, thank you guys. So again, popping or grinding sounds in the neck, especially when you turn, you'll hear kind of Rice Krispie sounds. Headaches, muscle spasms, numbness or tingling in the arms or hands. Usually worse with looking up or looking down for a prolonged period of time. This is really important, especially for those guys who are texting a lot or looking at their phones or checking the results of the election a lot. Stenosis and arthritis can affect people as young as 40 years old. So you don't have to be above 50 to experience it in the neck. You could be as young as 40. Actually, one of my best friends just experienced this and she's 36. So it does affect people as early as 30, really. Now, common causes of why these problems occur. And by the way, guys, I've only talked about arthritis and disc issues. There's a whole plethora of other things that could go wrong in your back. I'm kind of hitting the main ones here. Majority of folks, like 80% of you, will experience, and those who suffer from neck and back pain have these kind of issues. 20% of you might have something else that's a little bit more complicated or special. All right. Okay, so causes of herniated discs in the back: a fall or a large trauma. Now, this is kind of rare, but I've seen it. People who've fallen off horses, for instance, or parachuting accidents. Paratroopers also get it as well. Sometimes even really severe bad football injuries or motor vehicle accidents. But again, in the large scheme of things, in majority of our first world lives, this is a pretty rare occurrence. More usually, it is due to an overuse of spine, it's a spelling error there, sorry. Overuse of spine movements during heavy lifting or twisting, like not using proper mechanics. Like, so for example, this guy here who's lifting a very heavy box, bent over and not using his legs, he's gonna put a lot of strain on his low back. That's the inflection point over there. Other common causes of back pain and back arthritis. Now, this is really important, guys, because this is all to do with lifestyle. Okay, so highly correlated risk factors for back arthritis: heavy weight, occupation. So if you're a construction worker or you're in the army and you do a lot of heavy lifting, heavy manual labor, you're at risk for back arthritis. Also, family genetics plays a part in this as well, and smoking. So smoking reduces your oxygen capacity and it reduces healing in your cells. So that's a no-brainer there. Common causes of joint disorders in the neck, leading to herniated discs specifically. It's kind of similar. Fall or large trauma, like a car accident or sports injury. So if you are a football player and you ram into a lot of people, you're a defensive lineman, for instance, and you ram into a lot of people all the time, even though you're helmeted and you might protect yourself from concussions, that little like stick underneath your big old skull is still vulnerable. Same thing with boxers like myself. And repetitive or prolonged positions of strain. This might be familiar to a lot of you. Texting and looking at your phone and emailing, laptop work. The highly correlated risk factors for neck pain is also rather similar. There's genetics, smoking, and then here's another important thing: depression. So depression and back pain and neck pain are actually very much related. It's an issue of whether chicken or the egg. Do you experience depression and therefore lead a more sedentary lifestyle and therefore have this cascading event of back pain and neck pain? Or is it that you have severe back pain and neck pain chronically and therefore, end up being depressed? It's kind of a chicken or the egg situation, but surely, especially during this pandemic, a lot of this is going on, and they're all really interrelated. So there are 3 ways to handle pain, and this might be really familiar to all of you. Certainly to me too, I'm human, so I have to admit it. The first way to handle pain, you ignore it. Yeah, I hear this from patients all the time, like excuses. Oh, the weather's cold, that's why I'm hurting, or I'm old, I'm 42. Well, you could get older than that, but I'm old, or it's just in the family. I just gotta get over it. I just gotta, I don't know. It is what it is. So that's one strategy. The second strategy is, oh my gosh, my back and my neck pain hurt so bad, I'm just gonna pop pain meds like crazy. Pop pain meds like Tic Tacs, basically. Or invest in neck and back braces, which, by the way, this physical therapist does not endorse. Muscle rubs, some of you might, go to massage therapy, and I have to admit, it feels great. It feels wonderful. But the changes it changes only temporarily. So you might feel better, but within half an hour, you're probably back to being pretty miserable again. Because massage therapists, God help them, we love them, but they don't address the cause. And if you don't address the cause, you never quite solve your problem. Now, the third way to handle pain is to actually deal with it, to handle it, to look it in the eye and say, look, what's the deal? Why are you hurting me? Why am I hurting? What is the cause for my issue? And how do I deal with it? So the fact that you guys are all on this webinar right now means that you're doing the first step. You're trying to educate yourself on why this is happening to you and what can you do about it. So kudos to you for joining this webinar today. A lot of people don't get to this stage, sadly. They end up popping pills, and that's not a good strategy. So another thing about handling it is you have to take the initiative to relearn better habits. Oh my gosh, that is enormous. And it's extremely difficult, surprisingly, for us adults to relearn things. But if you take the initiative and the dedication to really change your habits, you could reap a lot of benefits. And one such example, unrelated to back and neck pain, flossing. So you could have moderate gingivitis and start flossing, and within a couple months of dedicated flossing, you could actually see your gingivitis go away. Now, physical therapy is similar, not exactly, but similar to that. So if you relearn better habits, you can actually prevent these things from happening or getting worse. So there's a little picture here, this guy in the blue on the right side, his neck is forward head like this, like turtling forward. That's what I call turtle forward. But if he relearns his habit to stack the neck in a much better posture, you could see how there's less pain, there's less pinching of his nerve, there's less disc pressure, and he can actually prolong the life of his spine and prolong his, basically reduce his symptoms and change his lifestyle. But how can we change our habits, right? I mean, habits are so difficult to change. And that is precisely why physical therapy is so hard. I chose probably the most difficult profession out there, not because it's difficult mentally, but because it's difficult to change people's habits. It has to be done piecemeal. That's what I've learned through my 13 years of being a PT. It has to be done piecemeal. But the number one thing that I found that is effective is core strength. So a lot of people do not put enough emphasis on core strength. They might put emphasis on it when they're trying to get a six-pack or trying to like lose weight for their vacation, but they're not putting as much emphasis onto it for their back health. They usually end up going to chiropractors. They end up going to get injections. Worse yet, some of them end up going to surgery right away. And those are just, they're either permanent changes or they're not one profession advocates for core strength. Why? Because it's extremely difficult to do. It takes a long time to gain muscle. It takes a long time to change your habits. Rome wasn't built in a day, and you definitely can't suddenly grow a six-pack in like 2 nights. So, it's extremely difficult to build core strength. But with a gradual, steady, piecemeal approach, you can get there with a little bit of patience, a little bit of dedication, a little bit of time, and I mean by 5 to 10 minutes a day, and maybe even a little bit of like reminding yourself when you're moving or lifting to activate your core. The effects are huge, huge. So why exactly is core strength so important? Now here's a picture of a spine. There's a rib cage, there's the pelvis. And by the way, above the pelvis is what? Your whole entire torso, your chest, your arms, your neck, your big old skull, everything, right? But what is that skeletally? What does that rest on? It rests on nothing but a stick. I mean, if you look at it, it's just a stick. It's just a simple little stick that's holding up the whole entire important parts of your body, your organs, your lungs, your brain, your heart, everything. All that weight is held up by a stick connected to your pelvis. No wonder we have so much back pain. Because if that stick is like moving around like this with no support, what happens? Snaps. But luckily, we have core strength. And this is a picture of a tree. Now that brown part in the middle, I'm using it metaphorically as a representation of the stick in your body, okay? The rings of that tree are the core muscles of you, basically. And the more developed and older a tree is, the more sturdy it is, right? So a new little sapling that doesn't have many concentric rings around it, you know, if you karate kicked it really hard, or if you took a car and you rammed it, that tree will likely fall down. But if you gain enough strength in your core and you build your concentric rings strong enough and thick enough, tree ramming into your trunk, it'll be like tree 1 U0, I mean tree 1 car 0. So what are those concentric rings within yourself? Well, they're the layers of the abdominals. And believe it or not, guys, there are a lot of layers of abdominals. Everyone thinks the abdominals are your six-pack. Not true. There are far more layers than that, and they do a lot of things. They act like a corset to your whole entire torso. So all those things, your chest, your lungs, your arms, everything is now bolstered up with extra support from your musculature. And what's so great about musculature is that you could build it. You can't build bone, you can't build spine. I mean, we're too old for that already, but you can build musculature. One caveat though, you can also lose it. So again, tying back to the pandemic, because it's really important what we're going through right now, if you've found your life to be more sedentary than it was, you've likely lost a bit of muscle. If you've gained fat weight, then you've basically increased the load that stick has to carry, okay? All these things play in part of why a lot of people are complaining about more symptoms during this pandemic than even pre-pandemic. We're just a lot more sedentary, sitting a lot, sitting on the couch and not moving, not going out, not exercising. The core strength is also applicable to the neck. Introducing the deep neck flexors. A lot of people don't talk about the deep neck flexors. They're actually right here next to your trachea, and if you activate them, you actually feel your voice box kind of constrict a bit. It doesn't change your voice, but you feel like as though, you know, you're kind of growing a bigger Adam's apple almost, or an Eve's pear. So it's very close to the trachea, and it serves to stabilize the neck. So you'll see a lot of people with very hypertonic neck muscles on the outside, and maybe you can see me, but a lot of hypertonic muscles on your upper traps and your sternocleidomastoid, fancy words for outside the core structure of the neck, but in the deep neck are these longus colli muscles that are super, super important in keeping your head stable. All right, so if I look to the left, I look to the right, these deep neck flexors are going to stabilize my neck as I turn. And it keeps it all in a really good position while I move. So all of these core muscles allow you to turn from this kind of posture on the left to this on the right. So I see folks who come in all the time with all myriad types of postures. You have, your old man posture with your really tight hamstrings. You have your pregnant posture with your belly sticking out. That's your lumbar lordosis. You have what I call engineer/computer posture, where, you kind of have a humpback because you've been typing all your life, basically. Same thing with forward head. So this is my teenager posture who text way too much. And then you have your good posture, which, by the way, you don't have to have militaristic style posture to have good posture. You just have to have a nice equilibrium in your spine, what I call neutral spine. So core strength allows you to get back to this good posture. All the rest on the four on the left, I bet you their abdominals are just so weak because they're not being turned on. They're not there to kind of keep things together. So, by the way, this is a picture of my husband. Here's some pictures of the neck. So he's texting right there. You can kind of see where that neck is bent right above the 3 stripes there. That's where like the inflection point is for his neck, and that's where a lot of people hurt themselves too, is they feel pain right there, right there, like near the upper traps. That's him working with poor posture, and that's me giving him an exercise to try to neutralize his neck. All right, so I asked you guys earlier this morning whether anyone has any specific questions. So I'm going to do my due diligence and answer these questions for you. I told this patient that a lot of people are probably wondering the same thing, so I thought to just include this. So question, how do I know if the pain is due to muscle issues like atrophy, fancy word for dying off muscle, basically losing muscle? How do I know if the pain is due to that or a nerve issue? Well, they actually come together. When a muscle is weak, you're unable to hold your torso or your neck up properly, especially with movement. This eventually causes joint degeneration, which in turn leads to nerve pinching by inflammation or bony disc structures. So what I'm trying to say here is when you are weak, like this guy on the right, you're going to end up putting yourself in a bad situation, a bad posture, and then you're going to create all that joint deformation and joint degeneration that then in turn causes that nerve pain. So they kind of go hand in hand together. You can't solve your nerve pain without addressing your muscle weakness. If that makes sense. They go together. Okay. Our next question was, physical therapy seems to be the first treatment getting suggested, but it won't help if there's nerve damage or there's some other underlying issue that can't be solved with physical therapy. I think what she was trying to say here is PT tends to be the first treatment that's given or suggested. However, she doesn't think that that it could really help nerves. And my answer is actually it will. If you're not able to gain strength and the ability to hold yourself up properly, you will continue to develop and worsen the nerve pinch, just what I said just now. Oftentimes, if you catch this early enough, this nerve damage and this nerve pain in your back and neck, your posture will change. So, if you start PT soon enough when the symptoms start, then you're able to change your posture, you're able to change your strength, and that actually may be enough to reduce your nerve pain and make it go away. And that's really, really common. I mean, my best friend, like I mentioned before, 36 years old, she started having neck issues, and then she went into PT. Now her nerve pain's gone. So, you catch it early enough, now you can actually nip it in the bud, basically. So listen to your symptoms. They are speaking to you. They're telling you, hey, do something about me or else I will get worse, right? PT can also help with other symptoms such as muscle spasms that kind of go together. I mean, it's not that the muscle spasms are caused or cause anything. It's just that they're kind of like a secondary effect of all this, of all these problems. You end up being in this situation like what this skeleton man is. He looks like he's in a lot of pain. No doubt his muscles are probably going to be on fire because they're trying to guard him from all that's happening on the inside in his spine. So, you know, when you tense up, those muscles have a really hard time in relaxing. Another follow-up question, which was really great, is how can we figure out the real culprit? Are there any specialized physicians who could help with this kind of thing? Well, you're looking at it, a physical therapist. We look at your habits, we look at you, we look at your movements, your posture, your lifestyle, and we piece together a story about why exactly you're hurting. Brian, our physical therapist in Cedar Mill, is an awesome guy for this. And guys, that's exactly what I meant. This job that I have is not easy because I have to really get into everything about you. Do you have young kids? How do you sleep? What pillow do you use? How many hours are you working from home? What devices do you have at home? Multiple things. Do you exercise? How hard do you exercise? Do you exercise too much? You know, all of these questions get unfolded as we look at you. And you know what? Name one doctor who asks the same type of questions that we do. I think that PTs really get into the nitty-gritty of lifestyle education and lifestyle evaluation. But that's not to say that there's a team of healthcare providers out there, even chiropractors. For the short-term quick relief, we also work in teams with orthopedic doctors, neurologists on the serious cases, and also physiatrists. So physiatrists are able to basically inject you with lidocaine and cortisone shots in order to reduce inflammation in those holes that I was talking about. So I know PT helps you with the posture and increasing the size of that hole, but sometimes there's just gunk in there that we can't take care of, and physiatrists go in there with an injection and clear it up with some medication. Orthopedics, they're able to do surgery. Neurologists, the same thing too, and they're able to test really the integrity of the nerve and whether there needs to be anything more serious that they could do. So we do work in teams with these guys, and if you are curious as to who Stride Strong and I trust in this Portland area, please shoot me an email. I'll give you my most trusted providers. We have no financial affiliation with them whatsoever. I want to mention that simply because, well, we're a separate entity, but also I vet them according to what their bedside manner is, whether they care about their patients, or whether they see you as a number, and how long they dedicate to making you feel better. Okay, so just email me for that quick list and I'll point you out to some. So now here's the fun part. I'm going to give some exercise giveaways. And I've had to think about this quite long and hard because I want to make sure that the exercise that I give out are going to help in the long term. So if you guys look at these exercises and you apply them to your daily life every day, I want to make sure that they maximize the effect on you. Which means that I'm not just going to give stretches that you can find on WebMD or find some stretches on YouTube or whatnot. These are the hard nitty-gritty stuff that actually, if you do forever, it will make huge differences in your life, okay? And I don't mean like huge differences next week. I meant huge differences in the long run. So the first one I'm going to do is proper posture and turning your Coke can into a glass bottle. Like what the heck are you talking about, Alice? I'm gonna demonstrate here, and I'm gonna stop sharing so you can see me on the video. Okay, so I should be pretty large now on your screen. So turning your Coke can into a glass bottle. I'm gonna zoom out here And by the way, guys, these are exercises you can do without much equipment. I mean, I'm sitting in a chair. So that's pretty much how simple it is. I'm going to sit here with good posture. And if I feel around my gut here, kind of squishy, kind of soft, might have gained a little bit of weight during this pandemic thing. But think of a Coke can. A Coke can is something that you could easily squish and smash, right? Well, think about taking your Coke can and turning it into a glass bottle. And I don't really need to like crunch. I don't need to like bear down like as though like, you know, I'm trying to give birth or whatever. All I'm doing is I'm making these abdominal muscles, this torso of mine, I'm making it stiff. I'm making it like just firm. So if I put my hands on my waist here and I'm relaxed, I can basically dig my fingertips into my gut and kind of, well, sounds gross, but feel around my organs, you know, squishy. But if I firm up my torso, and by the way, guys, I'm still talking to you, so I don't have to hold my breath at all. If I firm up these muscles, my fingertips can no longer sink in. All right? So firming up your abdominals makes a big deal. And by the way, try to firm them up without like doing this. Like, you know, if you're in bad posture and firming them up, you're not really doing anything. So you have to you have to stand, sit, or whatnot, with really good neutral spine here, and then firm them up. And now hold it. That's the key, is holding it for 10 seconds. You can't just like firm, soft, all right? That's called singing. So firm them up and hold it there for a good 30 seconds. Okay, how about this? Easy, right? We want to do little steps, 10 seconds. And breathe. Make sure you can breathe. So I'm talking to you right now and I'm firming them up. 9, 10. Good. Simple, easy, right? So you could do this anywhere, all the time. You could do it in line. You could do it in your car. You could do it while watching TV if you're sitting there with good posture. You can do it while you're working. And by the way, here's a big tip. I hope you really remember this. If you firm up your muscles before you do something difficult, like if you have a 32 pack of soda that you want to pull out of the trunk of your car and you know that's going to tweak your back, firm up your muscles, make it into a glass bottle before you lift and during your lift. And you'll notice that you can lift that heavy weight a whole lot better and cause much less pain on yourself. So that's a very big tool to prevent injury and also allow you to do certain things that are a little bit more challenging. Okay? And again, don't hold your breath and bear down. That's doing the wrong thing. That's more pelvic floor stuff. All right, so I think that I don't really want to toggle to the slide, but the next exercise is practicing the puppet master technique. And by the way, this is great for the neck as well. Puppet master technique, what does that mean? So again, pan out a little bit. Puppet master technique means that if I was a puppet, right? Like I'm soft, I'm a puppet, and there's nothing lifting me up. Imagine at the crown of your head, at the very top, there's a string, and your puppet master is lifting you up. Now, I don't mean military straight, because if it's military straight, you're kind of leaning back. But I meant just lifting you up by the string of your body. And you'll notice that your spine suddenly gets straighter and your neck is put in a good position. So if I completely relax and I'm completely limp, I look like this, but now my puppet master is lifting me up and then holding me there and then pulling me taut, and that's where my spine magically settles into. That's where I consider good posture. Now you can practice your glass bottle tensing. All right? So those are my favorite exercises for the low back. And I'm going to go back to the presentation. So that's for the back, and then for the neck. And by the way, I apply the Puppet Master technique for the neck as well because it fixes that neck posture. But chin tucks. All right, this one I don't have to toggle out so much because it's really easy to do. Everyone thinks chin tucks is like this. Wrong. This is not chin tucks. Imagine if you were lying down. You could do this standing up as well, but your nose is facing forward still, and you're just trying to gaze at your toes. That's it. As easy as that. You don't need to bend your neck. Your neck is still straight, but you're just kind of moving your eyes, trying to gaze at your toes. And what you'll see is your neck, by trying to gaze at my toes without moving my head, I have to retract it, meaning I have to move it backwards. And what happens when you retract it? You feel your neck kind of tense up a little bit, and look, my voice has changed somewhat. So if you get that nice constriction of muscles right near your trachea, your voice right here, you're doing it right. Similar to the glass bottle exercise, this is an endurance muscle. This is not a let me see whether I can like break concrete blocks with my chin tuck technique. This is an endurance exercise. So you have to hold it for a period of time. Do your chin tuck, try to look at my toes, my voice has changed, and I want to hold this for 5 seconds. And I'm out of it. Back on. And then I'm out of it. So you can do this exercise sitting, standing. You can also do this lying down. Extremely effective and very easy to do. You don't need any equipment. So there's that. Second is the Puppet Master technique. Third is standing against a wall with the back of your head and spine against it. Oh my gosh, I love this so much because it doubles as a stretch. So I'm going to take off my headset right now so you guys can hear me. I hope you guys can hear me. Right behind me is a wall. There's walls everywhere. So again, easy to do. All you need to do is stand against the wall, push your shoulder blades against the wall, and put the back of your head against the wall. Back of your head, guys, does not mean here, it means right here. So if you were to tie a ponytail, your ponytail should be pushing against the wall, okay? So little ponytail pushed against the wall, shoulder blades pressed backwards, and it automatically resets your posture. So if you've been doing this all day, like checking the results of the election, hint, hint, stand against the wall, get yourself to reset, and you'll find yourself getting into neutral spine magically. Now, don't stress if you're older and you can't quite get yourself flush against the wall. That's okay. Just as long as you try to get there, then you know you're going to have an improvement from where you were before. After standing here for a good, 2 minutes or so, you'll notice that when you come off the wall, you have a better sense of where your body should be rather than here. All right. So I'm going to put my headset back on so you guys can hear me. All right, let's move on. So the single biggest mistake is doing nothing. The longer you've had the pain, the longer it takes to get relief. And I tell this to my patients all the time when I ask them, or when I see them for the first time and I say, how long have you had this issue for? And they say, oh, I've had it for 30 years. I don't necessarily think that it's impossible. It is definitely not impossible to gain some relief and some potential huge relief or 100% relief. It's not impossible at all. It just takes longer. It takes longer, and it takes a much harder time changing your habits. It'd be like, changing someone who smoked for a month versus someone who's been smoking for 30 plus years. The bigger the habit that and the longer the habit, the longer it just takes to dig themselves out of it. So just keep that in mind. don't do nothing about your pain. So what does successful treatment look like? I've been a PT for 13 years. I've seen a lot of people come into my clinic and then like literally prance out relief, pain-free, back to running, back to doing everything they want to do. I've seen them all. And then I've also seen patients who have not been successful, sadly. But what does successful treatment look like? It looks like this: individualized evaluation to determine the cause of your sciatica and your neck pain. What I said was, we got to find out your lifestyle. Who are you? What do you do? What do you like to do? What habits have you attained that are bad? And then slowly, gradually introduce you back to the activities you love. You may have quit bowling. You may have quit gardening. You may have quit, I don't know, even violin playing. So, like putting your head to the side, all those things, all those activities that you love, you may have changed. And we want to know what you love to do. That way we can gradually move towards that. I think that right there is very life-changing for a lot of folks, because it's not enough just to get the pain away. It's more meaningful if you can get the pain away and actually apply yourself to the things that that defines you as a person. So that's why my job's really hard, because I have to really find out who you are and what makes you tick and how do I get you to go there. And by the way, the hard work is me teaching and guiding you there, but you do the hard work yourself by being dedicated and faithful to the program. And that's why some of my patients are really successful, and they get to prance out and attack the world as they did before. And it's really it's a great experience to be on that journey with them. So what we do, you might wonder what physical therapy is all about. I mean, chiropractors, it's easy. They crack joints, right? And then doctors, they inject, give you pills. What we do in PT is we work on your soft tissues. Okay, that's pain relief 101. Work on them, massage them. They will feel really good and thankful. 2, we work on strength. And that's me working on my friend. For her neck issue, I've been stretching her and working on getting her joints to move healthily. And then I'm working on this guy to improve posture and strength. So we do the hard stuff. We do like the stuff that takes a long time to understand and to hone in on. By the way, in this pandemic, we've had to toggle. We have telehealth options now, and we have in-person options for those who want a little bit more hands-on approach. Both are reimbursable, but with insurance. So if you have Medicare, if you have commercial insurance, we'll take it. And it's applicable to both telehealth and in-person options. If you want to get started on PT, please give us a call. Our numbers right there. And my email's right there should you want to ask me any specific questions as well.